So we'll talk about gout arthritis. Gout arthritis is a type of arthritis which occurs due to accumulation of uric acid in the blood, leading to deposition of uric acid in the joints. It will usually start in the big toe of the foot and the other weight-bearing joints. Usually the cause of increase in uric acid is either due to increased production of uric acid or poor excretion of uric acid. Conditions that will lead to increase in uric acid will be due to consumption of meat, especially from internal organs like the liver, the kidneys, the pancreas, consumption of red meat, consumption of some seafood, use of alcohol. Then you have patients with the kidney problems will have poor excretion of uric acid. Some medications like aspirin, cyclosporin, some drugs used in treatment of hypertension like the thiazide, like hydrochlorothiazide. Situations where patients do not take adequate fluids and they get dehydration. Situations of patients who are overweight, these tend to increase uric acid. Any kind of physical stress that increases body metabolism. Other situations that will lead to increased secretion of uric acid include patients on radiotherapy because of the increased cell death, patients on chemotherapy, patients who are also using other drugs. So the symptoms of gout arthritis include, they can happen either as an acute attack or can also be chronic gout arthritis. In chronic situations, we have acute episodes of excessive pains occurring within 1 to 2 weeks, and usually the pain will start with the big toe and then will lead to damage of the joint. And the pain is of sudden onset. There is redness of the joints, and the other joints of like the elbow, the wrist can also be affected. And usually the site of the swelling is warm, it's painful, and you may have deposition of tophi. Tophi are byproduct, accumulation of uric acid in the joints, causing some deposits, which will lead to deformation of the joints, and you also have bone deformities. In chronic attacks, you have repeated gout arthritis, which will lead to deposition of tophi, which are white yellowish nodules, which you will find either on the ear, you may find them on the fingers, you may find them on the elbows, you may also find them on the skin, and usually you may also have kidney stones in chronic gout. So the important in the diagnosis of gout arthritis is one, the history from the patient. You have acute attacks usually happening early in the morning. The pain is usually starts at the big toe, as I have said, at the base of the joint of the big toe, and the pain is usually excruciating and incapacitating. Then the other joints might be followed up. And if you do the history, you will also find there is that history of either excessive intake of alcohol. There is also excessive intake of meat, especially red meat. And in some situations, if patients are dehydrated for one reason or the other. So in the management of gout arthritis, the most important thing is patient education. Patients need to know what are the triggers, as I've said, consumption of red meat, some medications like the hydrochlorothiazide, which are used in the treatment of hypertension. If you have gout, it's good to let your doctor know this. High intake of alcohol, so patients will be encouraged to reduce their alcohol intake. For men, is 2 beers. For ladies, is only 1 bottle of beer. And also making sure that patients are taking adequate fluids so that they are well hydrated. There is also supportive management. You can have cold or warm compresses on the joint that are affected. Of course, encouraging the excretion of uric acid by hydration. So encourage the patient to take a lot of fluids, usually 2 to 3 liters in 24 hours. When there is an acute flare-up, then it is good to rest the lip. And for those who are overweight or obesity, then it is good to encourage them to lose weight. Then you have medications that are used in the treatment of gout, including NSAIDs, which help in the acute flare-up to control weight. Sometimes corticosteroids, which are drugs like prednisone, can be used. There's a drug called colicin, which is can be used for both acute and the chronic attacks to help in the excess secretion of uric acid. Then there are drugs that help to control the accumulation of uric acid, drugs like albuterol, which are used long term so that the uric acid levels are maintained at manageable levels. And there are also some drugs that help in the secretion of uric acid in urine, like probenecid. So the mainstay of management of gout is one, patient education, so that patients avoid the triggers, good weight maintenance, good care of the joints when there is an acute attack, getting treatment when there is an acute flare-up, and also the use of maintenance drugs to prevent accumulation of gout, and of course maintaining a good healthy diet and good body weight so that we maintain the stability and the health of our joints. Thank you for listening to us. We request that you subscribe to our YouTube channel so that you can get more these educational videos. Thank you.